Leishmaniasis. Transmission dynamics of sandfly disease.
Microbiology and medical parasitology study leishmaniasis as a vector-borne disease affecting humans and animals. Leishmaniasis spreads through the bite of infected sandflies, carrying microscopic parasites. These parasites multiply inside the sandfly before entering the human bloodstream. In tropical and subtropical regions, leishmaniasis causes both skin sores and internal organ damage. Researchers observe that sandflies thrive in warm and humid environments worldwide. Therefore, leishmaniasis often appears in areas with poor housing and limited sanitation facilities. Sandflies feed quietly at night, transmitting leishmania parasites without causing pain or warning signs. Moreover, leishmaniasis can persist for months if left untreated by proper medication and care. Urban growth and climate change increase contact between people and sandfly habitats. Scientists use molecular tools to track leishmaniasis infection rates across different regions and populations. Diagnostic methods help identify leishmaniasis cases early to prevent severe complications and spread. Public health workers control sandfly populations using insecticide-treated nets and environmental management strategies. Educational campaigns teach communities to recognize leishmaniasis symptoms and seek medical help promptly. Consequently, leishmaniasis prevention depends on community awareness, vector management, and accessible healthcare services. Understanding how sandflies spread leishmaniasis helps researchers develop better vaccines and treatments worldwide. The following story illustrates these ideas. At dusk in a small rural village, a young volunteer named Sophia sets a light trap near a wall. She studies the movement of tiny sandflies, gathering around the net. That evening, her microscope reveals a sandfly infected with leishmaniasis parasites. The next day, a doctor visits to explain how one sandfly bite can start an outbreak. Sophia joins a health team, distributing nets and teaching villagers to avoid bites at night. Weeks later, cases of leishmaniasis decline as fewer sandflies appear in the area. Her effort shows how understanding science can protect communities from disease. In summary, leishmaniasis demonstrates the close connection between parasites, sandfly vectors, and human health in vulnerable regions. The cooperation of researchers and local citizens helps reduce leishmaniasis infections and improve global public health outcomes.